Leading intervention radiologist talks about his education and experience. He did his training in the U.S. in neuro and body intervention radiology. He also has experience from working in India and Singapore.
Particularly like in multiple sclerosis, and till now the most of the people, they go for a medical management rather than any other surgical treatment and other things. But in last like few 6 months or 7 months, I am seeing that good number of the patients, they started inquiring about the intervention procedures, which is like in good number of the patient, around 70 to 80% of the patient in multiple sclerosis, they found that in the neck veins, which is narrowed, which is become a narrow and not too much dilated, having the multiple collaterals. Even in the spine, veins also get choked up, that is known as the azygous veins. And if you do the venoplasty, right, you put a small balloon on that one, this procedure done under the local anesthesia. If you make them dilated veins and if you put a stent on that, so the blood flow from the brain and the spine, that gets very well drained, and good number of the patient, around 70-80% of the patient, they feel that their symptoms, particularly the weakness and the difficulty in walking and the retention of the urine, and these are all things that disappear in a 1 or 2 week time. In multiple sclerosis, these procedures, like till now, so some Indian patients also there, and good number of the patients, those coming from the abroad, particularly the Canadian patients. Some few patients we done from the UK also. And these most of the patients, they are the very young, and they also knows that okay, these are the only the treatment available. They don't have any other options, so they wanted to try these procedures. In neurointervention radiology, right, is the very wide kind of the branch, right. If you see the what kind of the procedure we do without surgery, particularly in the arterial, the aneurysm coiling, right. And the surgeons, neurosurgeons, they do the surgical procedures, and in aneurysm coiling, this is become nowadays the very standard, and this is the first choice of treatment for aneurysm coilings, and some other conditions like arteriovenous malformation, and that also we treat by the AV fistulas embolization technique. And particularly like if you see in older people, right, maybe the male or female people, those having the osteoporosis in their spine, so we do the vertebroplasty, and that also is without surgery. We put a special medical cement into the collapsed vertebra, osteoporotic vertebrae, and they get the little more strength, and the pain and other problems that goes off within a day or two. Uterine fibroid and uterine adenomyosis. This is the big question for most of the women, those suffering by that. These women, they get the heavy menses, and there may be the 1 week, 2 week, this long period, and that gets low hemoglobin and other things, right. To making them aware, right, we made the India's first uterine fibroid club, and we give all the information and other things to all the women, those suffering by the fibroid and the adenomyosis. Till now, we provided information more than 50,000 women, and these are all the no profit, no loss basis. And we make them aware that these are the treatment available for you without surgery also. And good number of our patients, they get conceive also after the fibroid embolization. But individual patient has to be evaluated very well when you see that their scanning report and other things. In India, till now, we done in last 2.5-3 years more than 700 patients. This is the largest series when you see that, even in the European country also, in one center by the one person, they not done this much number of the cases.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.